Well, a PET scanner is a nuclear imaging test that uses a form of radioactive sugar to create images of body functions and metabolism. A PET scanner can be used to evaluate normal and abnormal biological functioning of cells and organs within a body. A PET scanner stands for positron emission tomography. A PET scanner was first designed by Dr. Gordon Brownell in the 1950s. He was inspired by his daughter, who suffered from a reading distortion that the doctors could not diagnose. Brownell created a simple scanning device that isolated the location of the diseased tissues in order to pinpoint irregularity in an organ. This machine helped surgeons discover and successfully remove a tumor that had developed in his daughter's brain. Over the years, this innovation was continuously altered and improved by several scientists and inventors. It wasn't until 2001 that Dr. Ron Nutt and Dr. David Townsend, who established an invention in the medical field, finally completed this device.
The PT scanner is a scanning device that creates 3D images of organs within a person's body using radioactive tracers. These tracers are used to produce a radionuclide, an atom with excessive nuclear energy, by attaching radioactive atoms with a chemical substance used naturally by the organ or tissue being tested. Radioactive tracers are administered to a patient through an intravenous injection into the vein. When the scanner begins to move, it detects radiation of gamma rays emitted by the positrons due to the breakdown of the radionuclide. After that, the computer analyzes these gamma rays to create brightly lit images of the tissues within the organ. The amount of radionuclide collected in the tissue affects how brightly the tissue appears on the image. One of the main reasons being was to help diagnose diseases. For example, Alzheimer's, Parkinson's, epilepsy, and Huntington's disease, or to detect a blood clot and bleeding diffusion within the brain. During many research phases, it was concluded that the PET scanner could also detect the spreading of cancer. This allowed the treatment for cancer to start early while reducing several risk factors in the near future. Furthermore, this machine also helps in finding a specific surgical site to successfully execute an accurate surgery needed for an undefined diseased tissue or organ. Other than the brain, the PET scanner can also be used in assisting the treatment of lung cancer and to evaluate the oxygen and blood flow to the heart muscle. Overall, a PET scanner is used to detect different types of diseases and its progression through treatments and medication.
There are hardly any severe harmful risk factors when getting a PET scan, but there are some precautions needed to be taken by the patient before being tested. During a PET scan, a person allergic to radiopharmaceutical may get a reaction. However, it is extremely rare, and it is usually diagnosed beforehand. Radiopharmaceutical is a radioactive compound, a drug used to diagnose when using the scanner. It is injected in the human body, which is explained in the How Does It Work section. Radiation can also affect an unborn baby. So a PET scan should not be done on a pregnant woman, and if they are still breastfeeding, getting a PET scan can affect the milk and the baby drinking it. Another smaller type of risk is that there may be swelling, bleeding, or soreness in the injection site. If a patient with chemical imbalances, such as a diabetic patient, takes the test, the scanner may also produce false results due to the distortion in the body. PET scanner can help humans in the best way possible, and the first way is that it's one of the safest radiation scanners. You only get injected with a little bit of radiation, but it quickly decays as time goes on. A PET scanner can help us avoid unnecessary surgery because it can tell us whether there's a lesion. A lesion is a region in an organ that has suffered damage, a benign, which is harmful, or malignant, which is infectious. As well as, it can help us learn more about the tumor in a patient, whether or not it is cancerous. Furthermore, it can also help detect cancer, such as lung cancer and breast cancers, or any other diseases that have spread. but lung cancers and breast cancers are the biggest ones. In addition, the scanner can also help doctors gain the most information needed to make a diagnosis and determine the most appropriate treatment. The new PET MRI positron emission tomography magnetic resonance imaging scanner is a more accurate and dependable way to diagnose different cancers. This opens the door to early disease detection as well.
While an MRI, magnetic resonance imaging scanner, is a medical investigation device that uses an exceptionally strong magnetic and radio frequency waves to generate images of the body. This device is usually used for detecting an issue with a patient's tissue, sport injuries, spinal injuries, and tumors. Now back to the PET MRI scanner. This new high-resolution and sensitivity device produces much more detailed three-dimensional images than a regular PET scanner, as well as exposes less radiation to the patient. PET MRI provides high-quality images of tissues, contrast with its MRI component compared with the regular PET scanner, which focuses more on the structure of the image.
The PET scanners that are currently used are a PET-CT scan combination. That means that there is a limited amount of radiation entering the body from the CT scan, computed tomography scanner. Right? The way to improve it is to use a PET MRI. So the MRI is used instead of the CT component. So that's how the PET-CT scan could be improved. It will lessen the radiation load on the human body. Any age range, okay? But if it's a PET-CT scan, healthcare professionals are reluctant to use it on children.
Okay.
Not recommended for use in children because of the effect of the radiation on growing body. During a PET scan, you will sit quietly in a room where you'll have an infusion of the radioactive isotope in a water and distilled water and sugar mix.
Okay.
Dripped into your body over about an hour and a half or so, an hour, and then you'll lie down on a bed. And the PET scanner will revolve around you, and it takes about 40 minutes. There's no preparation required, no special diet. Don't wear any jewelry or metal eyeglasses. PET MRIs are going to be better in that they're going to reduce the radiation load on the body. I don't know if they're going to have a finer detail.
Okay.
Don't know. But the CT scan uses radiation to penetrate the tissues of the body.
Yeah.
There's the potential for destroying the cellular structure of the cells that it's passing through.
Okay.
CT scanners are used to detect cancer tumors.
Yeah. But
CT scanners cause about 3 to 4% of cancers measured in the United States.
Yeah.
Not found by CT scanners, they're caused by CT scanners.
Okay.
So a CT scan radiates inwards, an MRI simply captures the electrical activity of the cells, and a PET scanner stands for positron emission tomography.
Yeah.
Tomography means they're still putting the slices and the pictures together.
Okay.
Positron emission means they're measuring the output of radiation from the body, not the input.
Yeah, okay. Output.
Because the radioactive sugar is emitting radiation. So the PET scanner has sensors that detect the emission of the radiation.
Oh, okay.
So it's almost the reverse of a CAT scanner.
So basically a PET scanner is better than both of them?
It's unique. It's not better because it can't be used to detect the things that an MRI, like soft tissue
Yeah, that's true.
structures,
Okay.
nerve activity, electrical nerve activity, activity in the brain. It's not used for that.
Okay.
So it's neither. So I mean, what's better, an X-ray or an ultrasound? It depends.
It depends.
You're
Yeah.
looking to measure, right? Every tool shapes the task.
Okay.
It's neither better nor worse. It's just different. But for cancer detection and staging of cancers in the body, it's the best.
In conclusion, the PET scanner is very beneficial for the patient and for the doctor. A PET scanner is a great innovation in our society, and we hope that as time goes on, this digital imaging device improves. We hope you've learned a lot from our video. Thank you for watching.